tugul ole mitei agwatochin ing tetutiet nebo Kass Mashinani ole mitei tuai eng betutab rani kwane Bernard Tanoi ara itagat ngeger agobo tuguk chetesetai eng emet ole kakomwa principal secretary noton nebo energy Alex Wachira kole makchingei ministry nebo rabinik anan ministry noton nebo energy anan kimnatoshek rabinik billion 1.3 eng supplementary budget nebo oeng nebo kenyitab 2024 ak kenyitab 2025 chekiboisien eng tetutik chebo roptaetab sitimet eng emet kong'ololi eng taitab committee noton nebo energy eng National Assembly komwa Wachira kole kokotet tetutik chechang ministry nebo energy chemagat kosuldae kibengeitab REREC ole mogotin rabinik chebo roptaetab sitimet ole kamwa CEO nebo REREC Rosalind Makamala kole imuchi REREC koyai projects oeng kityo eng constituency age tugul amu mayome rabinik akot kounoto komache MP nebo Chepalungu Victor Koech Mandazi kisuldae tetutik chebo roptaetab sitimet eng constituencies tugul chebo emoni eng kergeindo eng mwaet kole mitei constituencies chenyoru rabinik chechang kosir alak.
3 weeks ago, we had invited you to the signing ceremony of Kenya Off-Grid Solar Access Project, where we did sign the contracts for the construction of 113 mini-grid. COSAP, we had 2.05 million shillings that had been approved. It has now been cut down to 150 million shillings. That is not adequate for KPLC to pay advance payment, and we want to request this committee to help us that we at least KPLC confirms that they can be able to absorb 801 billion shillings in terms of advance payment, and so therefore we request an addition of 850 million.
We still find constituencies, rural constituencies, not comparing at all with the town constituencies. You find a constituency in rural constituencies like myself in Chepalungu and maybe my neighboring constituencies in Bomet, Kericho, the North Rift, being below 20% in connectivity. While in urban constituencies, you find that their connectivity is way above 90%. Meaning, we all fight for one budget. While we fight for connectivity, they fight for street lighting and so many other things, which means our priorities have to be aligned by ourselves. As we look into Northeastern, we should also, as an house, ourselves now as members, together with the ministry. And I believe the ministry has the data. Why don't you use this particular data to determine the amount of budget that goes to each constituency based on its connectivity, rather than having a wholesale budget saying this budget, for example, 8.7 billion, and we all fight for the same budget without considering these constituencies that are way below their connectivity. Why can't we act? And this goes further into many other departments, like roads. You find a constituency that is far much developed, getting a budget of 13 billion in one financial year, while a constituency that is in the rural constituencies get less than 100 million. Then you tend to think that we are not in the same country. Yeah.
Others zero.
Others even zero. You tend to think that we're serving the same government, but as they say, there are far much better animals than the other animals.
When you look at what is happening currently, there is a lot of need. Members of Parliament and other stakeholders are coming to us requesting for more projects. The amount of money we have in the budget currently is allowing us to do between 1 and 2 projects per constituency. But the need is higher than 1 to 2 projects. So we are requesting for the 50 million per constituency if it can be reinstated. The other issue, Chair, that I would want to bring to the attention of the committee is on the issue of electrification of off-grid areas. I know we signed COSAP, and within COSAP, we are going to do together with KPLC 113 mini-grids.
We have issues with maintenance of these off-grid stations, and unless something is done, then it is going to be a big problem. It will look like the solar installations that we have for schools, that we did solar installations and less than 10% of these solar installations are maintained.
Ko abwatun kityo ale eng tetutiet noton nebo betutab rani niton nebo Kass Mashinani ko mokoi ketindoi toondet nemokoi konyo yu asi koarorwech ole king'ololen akobo kibagenge ak kandoinatet eng emoni ole nyone ine Henry Rop ne naat kora ko cheptirgei konyone yu asikobit koarorwech akobo kandoinatet koboto kibagenge eng emetab Kenya asikeng'alale tetutik cheterter chetinyegei ak kandoinatet koboto kibagenge nemagat komitei eng emet asi kotoret kora eng kareunet noton nebo bandab tai ko kounoto ko ng'alalet noto nemokoi ketindoi eng tetutiet nebo betutab rani niton nebo Kass Mashinani kobate ketestai keker logoiwek chetesetai eng komoswek cheterter chebo emet ole katach logoiyotab kongoi Dr. Jane Mwikali Makau ne ine ko nebo ng'echeret eng kibagengeit noton nebo Betting Control and Licensing Board BCLB kobun kampunitab BankBet kosubkei ak nekokikochi konunotiot eng 2025 Africa Gaming Expo nekokiyai eng emetab Nigeria. Katach Dr. Makau konunotiot nebo Regulatory Alliance Award 2025 amu eng boisionikchik eng BCLB eng emoni ak tetutikchik eng kanabtaitab kosubetab ng'atutik eng emoni ak Africa komugul kosub ak kandoinatetab Dr. Makau ko kokeboisie emetab Kenya eng kanetutik chetinyegei ak urerietab bahati nasibu ako kaboisie noto BankBet kowekchi ine kongoi eng kanabtaitab kosubetab ng'atutik eng ureriet eng emoni eng sekta noton nebo ureriosiek chebo kelchinet anan bahati nasibu. Ketesetai ko ngetoben logoiwek alak ole tesetai serikali ak kakimitetab sekta noton nebo kahawek eng emoni ole tesetai koyoe walutik cheterter eng tokyinetab koker kole kanyor kelchin kabatik. Kou noto ko kayai tuyet Deputy President noto ko Professor Kithure Kindiki eng ofisinyin nemite Karen ak stakeholders cheterter anan ak MPs kobun komoswek chekole kahawek eng chongindo cheboto kebeberta nebo Rift Valley, Central, Eastern, Western ak Nyanza asikong'alale tetutik choto chebo kakimitetab sekta nebo kahawek eng emoni ole mising ko kakimitetab kesutik chekinyoru eng embar kobun kahawek ole kotesokis akoi kilo 10 eng kokakikes kahawek kong'ete kilo 2 ak kounoto kokimit Kindiki kole tesetai serikali ak makenyi noto nebo kokanapta sekta nebo kahawek eng emet asikonyor kelchin kabatik.
The issue of governance of coffee cooperatives is at the center of our success story. The issue of removal of conflict of interest, eradicating cartels, and the people who have made sure that the farmer is suffering over the decades is at the center of our success story. And I want to assure you that with your political support and the support of the farmers and the members of the public, we're going to go out of our way to remove the remaining bottlenecks around conflict of interest, but also around improving governance. Once the new cooperative law takes place, we are going to have better governance at the factories. If we remove the indebtedness in that sector, improve the equipment for processing our coffee, do our marketing, bring new area of land under coffee production, including irrigated coffee farming, we are looking at a sector that could easily double, triple in the next few years, even as we look forward to the end of the first term of this administration.
Tai ko kakokimit minister nebo tililindo Dr. Deborah Barasa kole tesetai serikali ak kasuldaetab tetutik cheimuktechin biikab emoni konyor konyoiset neititaat kobun tugetab konyoiset nebo SHA. Kong'ololjin sirikab logoiwek eng ofisinyin nemite Afya House eng Nairobi, komwa Dr. Barasa kole kikonoptoi konyoiset eng komoswek chebo gaa anan konyoiset noton nebo primary health care asikonyor konyoiset biikab emet eng oret ne nyumnyum. Ng'alek chekaikoch kosubet Director General nebo konyoiset eng Ministry nebo konyoiset Dr. Patrick Amoth nekamwa kole ipchin komonut Ministry nebo konyoiset chametabgei noton nebo biikab emet ak kounoto kotesetai serikali ak kakimitetab sekta nebo konyoiset eng emet. Kongenyoru report notok eng koindo kobun sirindenyo Gladys Yator.
Kakokimit TS neindochin boisionikab tililindo eng emoni Deborah Barasa kole tesentai serikali tetutik chotok kanoptoi tililindo akoityi konyoiset chong'indab biikab emoni eng oretab nyumnyumindo. Kong'alali inendet eng tuyet koboto sirikab logoiwek eng nekaikimit inendet kole eng tetutiet nebo koityi toretetab konyoiset biikab emet eng chong'indo ko ikimiti serikali sipitalishek chotok mitei eng kokwotinwek eng nekamwa kole notok oret agenge newendi konyoru biik konyoiset eng kasarta nemagat.
Our focus on primary health care remains a top priority. UHC is designed to drive more people towards the primary health care services, ensuring that diseases are detected and managed early before they escalate into costly emergencies. Utilization data for January 2025 clearly confirms that we are on the right trajectory. This will also reduce the pressure on higher-level hospitals, ensuring that referral facilities focus on complex cases, while primary healthcare facilities handle routine care, preventive health, and early disease management. We call on Kenyans to embrace primary healthcare services, which will be more accessible, affordable, and effective under the new system.
Eng kasarata komwa Director nebo Health Patrick Amoth kole eng kasuldaetab tetutionotok eng oret netogunot ko kikeistoegei lewenetab sipitalishek eng tugetab SHA eng biik chotok kikomuch kosirgei.
Capitation payment. Again, this will also be able to remove that barrier that was created by pre-chosen facility. Now, based on this, because we use the number of people who have registered to budget, it means you can be able to go to any facility. You are not restricted to a particular facility to receive services. Facilities will be able to submit returns upon which then SHA will be able to make the reimbursements. So it gives you the latitude that you are not restricted. If you come from Kwale and you are in Busia, for example, you will be able to receive the services. Busia, the facility in Busia, will lodge the claim with SHA, and SHA will be able to pay that money. So going forward, the money is going to be at the facility level, and we want to urge the county government under the FIF Act to be able to strengthen the committees at the health center level, the dispensary level, so that upon receiving the money, they can be able to prioritize procurement of health products and technologies, especially medicines, laboratory commodities, and also the requisite equipment to ensure continued service delivery to the people.
Eng taonitab Nairobi, logoiwekab emet chebo Kass, kainenyu ko Gladys Yator.
Kakon kayomisenyi Deborah akot eng kasarta netesetai kobitu koimutik eng sekta nebo konyoiset eng emet, mising ko nemaboisie komie tugetab konyoiset nebo SHA koboto kangelchinetab boisiet ak ambakosiek chekotestai koyai kiboitinik chebo konyoiset eng emet cheboto kiboitinik chotok chebo UHC chetomo kesir kong'ete ngikoch boisionikab contract eng kenyitab 2020 ole kokoyai kambaget komoche serikali kobun ministry noton nebo konyoiset kokochi icheket boisionikab kipkoi anan permanent. Ole bitu nito kora akot eng kasarta netesetai koyai kambaget ak strike kiboitinikab konyoiset chenootin ko clinical officers eng komoswek cheterter chebo emet, ole koimongei gavana noton nebo Nandi Stephen Sang akosom ministry noton nebo tililindo kondochin Deborah Barasa koisto koimutik ak terchinoshek chemitei eng kwenutab serikali ak ofisaekab tililindo eng mwaet kole weche notok kasuldaetab tetutikab konyoiset eng emoni kosubkei ak sang komanyolu kitaban clinical officers eng tugetab konyoiset nebo SHA eng mwaet kole ofisaechotok koyoe boisiet neo eng sipitalishek ak kounotok konyolu kekosyi rirekwai asimawechokis tetutikab konyoiset eng emoni. Ko ngenyoru report notok kobun sirindenyo eng kebeberta nebo Kapsabet Cornelius Keter.
Kailos Governor nebo Nandi Stephen Sang tugetab konyoiset nelel nebo SHA eng mwaet kole tindoi tetutikab konyoiset chemi barak ngekerchin ak nekibo NHIF ole kamwa kole ng'alek chokotestai koletagei kele makararan tugonotok bo SHA komobo iman ngamitei kewelutik cheng'ering'en eng tugonotok chetesetai serikali koletiti.
If you look at the tariffs that are being implemented under SHA with regard to the various categories of health service provision, there is a huge improvement. A very good case or example is that previously under NHIF, a cesarean section, the county would claim only or would be reimbursed only 5,000 shillings. As we speak today, under SHA, the county will be reimbursed 30,000 shillings. That means that the opportunity to increase the resources, courtesy of service delivery to the facility, and now that we have the facility improvement fund facility, means that all these resources will be claimed and the money will be given back to the facility for improvement.
Kasom Sang SHA konde tai ketesyoshekab konyoiset chebo serikali eng katiaktaetab chepkondok eng kasarta neititaat kosubkei ak netiegei sipitalishek chotok chepkondok chotok eng kokoitoetab tetutikab konyoiset koityi biikab boror ak korirtae ine ministry nebo tililindo eng nikitaban konyoik chenotin ko clinical officers eng nemoityin tugonotok bo SHA eng kasuldaenwa nebo konyoiset.
And we are also asking SHA to prioritize particularly health facilities within the public sector in terms of their reimbursements so that this process can be made faster. We sat down as the Council of Governors, had a discussion on this particular matter. We even signed an agreement that the Ministry of Health were going to implement the law by ensuring that clinical officers are allowed to participate in the service provision as allowed by law as they have always done under NHIF and now under SHA.
Kamwa Sang kole nyolu eng ministry nebo tililindo koityi kamanut matwet age tugul nebo konyoiset ak koisto terchinoshek chemitei eng kwenunwa kokoch matwet age tugul boroindo nebo kosuldae boisienwa eng oret nenyolu ak nekikoch katiba.
What is the reason why the Ministry of Health, SHA and Digital Health have not allowed clinical officers to do their job? Because of unnecessary sibling rivalry, maybe between doctors' union or the doctors' council and the clinical officers' council, we now have an industrial action nationally that is affecting us. When the issue is something that can be sorted out, it was agreed upon, we have an agreement on it, the law allows. But then, for some reason, some senior officers within the Ministry of Health are taking their sweet time and appear as if they want to frustrate that process. So we want to ask the ministry, please, we have more issues to deal with. We are already dealing with those issues. We are your partners in the rollout of SHA, but allow each and every cadre of healthcare workers to contribute to the successful implementation and rollout of SHA.
Kongete taunitab Kapsabet eng county nebo Nandi, logoiwekab emet chebo Kass, kainenyu ko Cornelius Keter.
Ko noto ko report noto nengete county noto nebo Nandi noto nega imutech agoi komung'et kitigin asiyekiwege ketestai ak ng'alalenyo nebo betutab rani ole king'ololen akobo kibagenge ak kandoinatet eng emet ole tot nebo betutab rani ko Henry Rob ne naat kora ko cheptirgei nenyone yu asi kwarurwech akobo ole uu kandoinatet ak kibagenge eng emetab Kenya mising ko eng kasari tesetai chobetab serikalit nebo ra noto nebo broad based government eng emetab Kenya ako tos boroindo noto nebo neranik eng ng'alekab kandoinatet ko ne ako noto ko yekiweke eng komung'et kenyoru inendet Henry Rop asikobit ketestai ak ng'alalet nebo betutab rani. Metwake eng ole ime testai iker Kass TV amu kimnotet naet.